Welcome to Learn to Live Stress-Free. This is Christine Wright with Dr. Robert Wright Jr., your go-to wellness coaches of www.stressfreenow.info. Our featured guest today is Dr. David Clarke, discussing how to heal unexplicable pain when you are suffering from psychosomatic distress. Dr. David Clarke is president of the Psychophysiologic Disorders Association and is a clinical assistant professor of gastroenterology emeritus and assistant director of the Center for Ethics, both at Oregon Health and Science University. He is board certified in gastroenterology and internal medicine and practiced in Portland, Oregon from 1984 to 2009. Dr. Clarke has received numerous awards for excellence in patient care. He received his BA in psychology from Williams College, Phi Beta Kappa, and his medical degree from the University of Connecticut in 1979. Since then, he has successfully cared for thousands of patients with stress illness, often sent to him after other doctors were unable to help them. He has been a visiting professor at Oxford University Hospital in England and at the Royal Children's Hospital in Brisbane, Australia. He was twice named a top doctor in Portland Monthly magazine. Dr. Clarke is the author of They Can't Find Anything Wrong, and his book has been featured in several magazines, including Elle. For his own stress, he prescribes playing indoor soccer, photography, hiking among mountains, adventures with his family, and his wife's cooking. He lives in Happy Valley, Oregon, which is near Portland. Dr. Clarke also has a website and blog called The Stress Checkup. Dr. Dave, welcome. Thank you for being with us today.
Thank you. It's great to be with you.
Yes, David, very nice to have you on our show. And audience, this is going to be an amazing interview today. So, Dave, you're a very accomplished person and well-known in your field. Can you briefly tell us your story and how you came to be interested in helping patients suffering from psychophysiologic disorders?
You bet. I'm a very traditionally trained specialist in gastrointestinal diseases, and I never expected to be anything else. But toward the end of my formal training back in the 1980s, I encountered a patient for whom we had absolutely no explanation for her very severe illness. And this was after thorough diagnostic testing at two different university hospitals. And I accidentally stumbled on the fact that she was suffering from a severe level of stress that nobody had uncovered in her history before. I got a psychiatrist involved whom I knew was interested in brain-body disorders, and was shocked a couple of months later when I learned the psychiatrist had cured the patient with a few months of counseling. And I thought that was just unbelievable. And I prevailed on her to give me some of her ideas of how she evaluated people with these conditions and how she treated them, thinking it might come in handy a half a dozen patients a year once I got into practice. Well, it turned out that it was more like half a dozen patients a week. So, here we are 7,000 plus patients later, and I seem to have become an expert in this field. But came as a complete surprise to me that there were so many people suffering so much from these problems.
Thank you, Dave. That makes so much sense, and what you say resonates on many, many levels. When I went to school as a dance student, I studied the practice of ideokinesis, which works to improve alignment by using imagery. And in that, the instructor talked about the connection between the body and the mind in a way that I think is becoming more commonplace now. So when you talk about in the beginning of your practice, noticing this relationship between what has happened in your experience, in your life experience and illness, I think that's really extraordinary for you to have picked that up early in your practice, and it's fantastic that you're doing this. And this aspect that you talk about, you had the awareness by working with so many people, but I imagine when a patient comes to you, this is not a thought in their head either. The effects that stress and stress burnout can have on their system in terms of causing illness. Can you share your view on why it's important for individuals to get a handle on their stress?
Well, in my patients, it's quite typical that important stresses in their lives are not fully recognized. That the symptoms that people have from this are absolutely real. They're just as real as symptoms that are caused by organ diseases or by structural abnormalities, but they're coming from issues in a person's life that the magnitude of which is not fully appreciated. And so because of that, there's not anything that the person is doing about it, and they can go on to interfere in people's lives for years and sometimes even decades. So it's only when we uncover what's going on, when we help people to recognize a particular stress or stresses that are affecting who they are, that's when we begin to make progress. That's when we begin to initiate the process of healing. And it's important also to realize that there's more than one type of stress that can do this. Some people, it's stress that's going on in their lives today, but other people, it's the prolonged effects of stress in childhood, and that turned out to be important in well over half of my patients. And then still other people have a mental health condition that they don't, again, fully recognize. This could be depression, it could be effects of a trauma that they've been through, or it could be an anxiety disorder. And any one of those three can actually be quite subtle, and people may not appreciate that it's going on.
Thank you. That made me think of that boiling frog.
Yes.
That people talk about, that if it's incremental over time, you tend not to notice it until it stops you in your track. And then they come to Dr. Dave, help me, what's going on? But they've been living with this condition and not realizing the impact.
Yeah, it's absolutely true that you don't have the ability to kind of step out of your life and look at yourself objectively and see what it is that you've gone through, or compare your life with a life that might have been free of stress. You have to try to understand it from the inside, and that's just simply too difficult for most people to do. So often we need help from an objective observer who can evaluate you for sources of stress and help you recognize when something that's happened in your life is affecting you more than you recognized.
Dave, many in our audience may not be familiar with the term psychophysiological disorder, or otherwise known as PPD. Can you define that term for our listeners and explain why they should care about PPD?
You bet. Psychophysiologic comes from a couple of Greek words, and it basically just means brain-body. It has absolutely nothing to do with being psychotic or being psycho. We want people to be very clear on that we're talking about a condition where the brain and the body are interacting with each other to produce real physical symptoms. And in fact, most of my patients are mentally stronger than average. This is not about being weak. This is not about being unable to handle normal levels of stress. It's about being affected by levels of stress that would bring most people to their knees and that are manifesting in the form of real live physical symptoms. And it's important because of how common it is. It's estimated that about 1 in 6 adults suffer from this condition at one time or another. And that means 40 million people in America alone, which is 60% larger than the number of people that have diabetes. So it's a huge number of people, and yet, unfortunately, very few physicians have had any formal training in how to diagnose and treat it. So it's a huge problem.
Great. Dave, when you were talking, what flashed in my mind when you mentioned the psychophysiologic aspect, have you had patients or perhaps even other doctors who have thought there's some psycho aspect to this, that kind of a weird kind of thing? You know how some people are afraid if you bring up the term psychotherapy. Have you actually had that in your clinical experience?
Oh, absolutely. Anytime you bring up even the word stress as a possible cause of illness, people think that the doctor believes that they're just making the symptom up, or it's all in their head, or it's somehow imaginary, or that they're faking it for some reason. But none of that is true. These symptoms are completely real. They can be just as severe as symptoms caused by organ disease or structural abnormalities. I've had some patients who've been in the hospital for days or even weeks with stress-related illness. I've had patients who've been ill with it for decades. And it's absolutely convincing when you interview people with this condition how real their symptoms are. It just happens that the cause is coming from stress, and we know this because when we uncover the stress and we treat it successfully, people improve. The very first story in my book is a patient who was hospitalized at a university a total of about 60 times over 15 years, and nobody had any idea what was wrong with her, but by knowing what to look for, I was able to uncover the particular stress that was underlying her illness, and in her case, she was cured on the spot. I mean, within an hour, we brought the issues to the surface. She was able to deal with them at that level, and she went home from the hospital the next day and never had another one of her episodes. I wish I could say that was true for all of my patients. Most people need months or years of treatment to fully recover, but sometimes dramatic results like that are possible.
Well, Dave, I'm listening to your story, and I'm boosting you up to the level of Dr. Milton Erickson, who was getting amazing results. I had looked at one of his talks, and what was surprising to me, in his particular case, he said that he was getting incredible results healing people, but he often didn't know why it was. I'm thinking that, whatever he was doing, in his case, sometimes using indirect metaphors, was actually busting down and dissolving that stress. What to get underneath from a causation standpoint. Let me ask you this. It just occurred to me. What has been the response from your medical colleagues? Have they been supportive or open to this approach that you have? Because I don't believe in the standard medical school curriculum that stress is addressed in that kind of way. Or has that also changed as the new research has come out?
The response of my colleagues has for the most part, been outstanding. I mean, physicians focus on results, let's put it that way. And in the early years, I have to admit I was struggling to understand what was causing the illness, what was the link between stress and illness. But I had a department chair who believed in my work. He gave me extra long appointments to talk to patients with these problems. And it was through those interviews with hundreds and later thousands of patients that I came to understand what was needed for successful diagnosis and treatment. And once I reached a high level of practice, more and more of my colleagues were sending patients to me. And it wasn't long before I found myself doing 85 or 90% of the second opinions for a 12-person department. Because they could see that I was getting results, positive outcomes for people with this condition that, no one else was achieving.
Great. The reason I asked that question, Dave, is that, I've done quite a bit of studying in the field of psychoneuroimmunology for a long time, and then I'm very well-versed in the work of Dr. Herbert Benson, from Harvard Medical School.
Yeah.
And if you go back to the 70s, 80s, and 90s and look through the literature, there was a tremendous amount of pushback in terms of whenever someone said stress might be directly or indirectly causing a malady. So I'm very happy to hear that you're a medical doctor saying that, and that the response is that, hey, we're interested in results. And once you have an understanding of causation, that stress may be directly or indirectly causing a situation. So I'm very happy to hear that. Now, Dave, You're the president of the Psychophysiologic Disorders Association, and I know you, based on what you said, you have a very broad and see a broad range of illnesses and disease states that can rise when stress is unresolved or not addressed. Can you share with our listeners how and why a person suffering from psychosomatic distress can experience debilitating pain, insomnia, irritable bowel syndrome, or even chronic fatigue syndrome?
Yeah, chronic fatigue probably has more than one cause. Probably some people with that, there's a psychophysiologic component to it, but there's probably other causes to that. But the other conditions, it is one of the remarkable features of PPD, the range of different symptoms that can result from it, literally from head to toe. I mean, migraines, fibromyalgia, ringing in the ears, lump in the throat, stiffness in the TMJ joint of the jaw, difficulty breathing, chronic cough, low back pain, neck pain, pain in the female pelvis, irritable bowel syndrome. I mean, the list of symptoms goes on and on. If there's any common denominator, it's the tendency for people with this condition to have more than one symptom at a time. In fact, one of my patients actually had 27 different symptoms that he had listed for me when he came in to see me. So the reason behind this, probably twofold. For one, the autonomic nervous system, particularly the sympathetic nervous system, the fight or flight nervous system, is involved in this condition, and that's a system that goes throughout the body. And we've also got evidence now from what are called functional MRI studies that the brain in people with PPD is actually processing pain signals in a way that's different from healthy people. And of course, signals that are coming from the body to the brain can come from anywhere in the body. So I think that we are beginning to understand the actual underlying physiology of this condition, and it absolutely helps us to understand why so many different places in the body and such a huge variety of symptoms can all result from this same underlying condition.
Thank you for that, Dave. Audience, we'll be back in a moment on Learn to Live Stress-Free with our featured guest today, Dr. David Clarke.
Have you been procrastinating about completing an important project or following a treasured dream? Hi, this is Christine Wright. I specialize in helping my coaching clients to lay out clear, goal-achieving strategies. I show you how to quickly build your confidence and uncover and eliminate your habitual patterns of resistance and self-sabotage. Let me help you discover those meaningful insights that will get you to do what works so you can celebrate your successes. Go to stressfreenow.info/contact to let me know that you're curious about how to live your ideal life now. Again, that's stressfreenow.info/contact. Are you dealing with stress, burnout, chronic pain, anxiety, or unresolved grief? Dr. Robert Wright, Jr., the Stress Relief Doctor, is an author, speaker, and stress management wellness coach. Co-host of the Learn to Live Stress-Free podcast series, Dr. Bob holds a Ph.D. in Transformative Studies and a master's degree in psychology. He is the author of the first published study to show the connection between stress reduction, grief recovery, and nitric oxide spiking and the relaxation response. He has a wealth of practical knowledge which helps you to relieve the stresses of everyday life so you can live longer and play with your grandchildren. Work with Dr. Bob and he'll give you the tools you need to dissolve your pain points quickly and effectively. Email him to find out how you can start to feel better at stressfreenow.info/contact. That's stressfreenow.info/contact.
Welcome back to Learn to Live Stress-Free as we continue our discussion with Dr. David Clarke. David, there are many studies which indicate that the source of pain is in the brain. I should say many new studies which are indicating that the source of pain is in the brain. Do you agree with that view? And does your own clinical experience with patients demonstrate that? I know right before the break you mentioned nerve pathways, so I'd like you to elaborate on that, how maybe they could be inflamed or the signaling pathway may be disrupted in some way.
Yes, before the break we talked about how the processing areas of the brain, the areas of the brain that process pain signals or signals from the body, are different in people with PPD. And the way those studies are done, and I'm sure we're going to see many more of them in the coming decades, is that you take two groups of people, one group that's healthy, that has no symptoms, and the other group that has a PPD disorder of one sort or another, and you inflict pain on each group, either by, say, blowing up a blood pressure cuff until it hurts or applying heat to the skin until it hurts. And then you watch what's going on in the brain, what areas are actively metabolizing using a device called a functional magnetic resonance imaging machine. And it turns out that the healthy people and the people with the PPD, their brains work in different ways in response to that pain. The areas of the brain that become active in processing those pain signals are different between the two groups. And this is really the first time that we have seen anatomic evidence of what's going on in PPD. And I'm sure that's only the first step in fully understanding the physiology, but there's no question that the brain is going to be heavily involved in that. But at least it's nice to have confirmation for people that, yes, this is not imaginary. There really is an anatomic difference that's responsible for at least a chunk of these symptoms.
Dave, thank you so much. As I listen to you, it just sounds so logical to me that, as you talk about looking at illness simply from the perspective of, organ disease, as you say, or structural abnormalities is all well and good. But the totality of the human being is so much more. I mean, we've got so many individual differences. I remember taking a workshop once, and there was a participant, and I thought it was very strange. The instructor kept saying we were going to be doing some work with watercolors, and that this person needed to leave the room. And I'm like, why would she need to leave the room? But she got physically sick with the dye or the fume from the paint. So each organism acts differently, where every system is so individual. I mean, I think that's the beauty of seeing a physician, that you've worked with thousands of people over the years, and each person's system responds differently structurally, in addition to whatever stressors have been in their past or their present. Can you speak a little bit to that indefinable, if you will, aspect of diagnosis and treatment?
Well, this is one of the aspects of PPD that is not fully understood yet, which is why does one individual who seems to have stress levels and sources of stress that are similar to another individual, and yet the two of them may have completely different symptoms. Now, in some cases, we can trace the difference to a time when the individual had an injury in a particular area and there was a source of structural or organ-based pain in that area, and then that healed, but then many years later, those same nerve pathways were used when the individual was subject to stress, and the pain flared up again in that exact same area. But most of the time we don't see that. Most of the time the nature of the individual symptoms are somewhat of a mystery as to why one person gets low back pain, for example, and somebody else gets irritable bowel syndrome. That's going to be a question for research in the future to answer for us.
Oh, so lots of grist for the mill here. I can see this. Now, you mentioned this low back pain. Dave, so many people, Bob has done articles about stress and pain, and I was shocked and surprised by the numbers of people who experience chronic pain in some form or another. And I think low back pain, so many people have that at some point or other in their life. And another thing is neck pain. Would you take a moment here and just give our listeners some tips for reducing or eliminating those two particular pains?
Well, we should probably focus on people whose pain persists for longer than a few weeks and that's not getting better with rest and simple over-the-counter pain relievers. When that pain is constantly coming back and when it's going on for a period of years, clearly that situation needs to be evaluated by a physician. to make sure there's not a structural or other cause for it. But we get into some difficulty here with what are called false positive results, because when people get an MRI, say a magnetic resonance image of the spine, it's not unusual for minor abnormalities to turn up. This was documented in a study published in the New England Journal of Medicine about 20 years ago, which showed that a large number of people over the age of 50 are going to have minor abnormalities in their spine. So it's very easy, however, if you've got symptoms in that spine and then the MRI shows you've got some abnormalities there, to say, aha, we found the cause of your problem. But if you do MRIs, as I say, on people with no symptoms at all, you find those same very mild abnormalities. So it's important not to leap to conclusions here, and just because you see a mild condition, immediately attribute it as a cause of the pain. It's important to do a full evaluation, which in my practice involves assessing for stress. Are you under stress in your life at the moment? Are you the kind of person that takes care of everybody else in your world and has difficulty putting yourself on the list of people you take care of? Were you under stress as a child? Did you have a life experience when you were growing up that you wouldn't want your own children to go through, for example? And then those mental health conditions that I spoke of. Lots of people with the disease depression don't feel particularly depressed, but they have other symptoms that signify that illness. They're not sleeping well, their appetite is off, their energy level is down, their feelings about their value of their life are off. Things they used to love to do are no longer as enjoyable. Those are symptoms of depression that can creep up on a person without their being aware of it. Post-traumatic stress, our combat veterans, for example, or anybody who's been through an assault or a serious motor vehicle accident might be subject to that. And then finally, the anxiety disorders, people having worries, nervousness, tension, fear that's out of proportion to any reason for those feelings to be there. These all need to be evaluated in people with spine pain and then treated if they're found, particularly when the abnormalities on the imaging study are relatively minor.
Right. Thank you so much. That was such a comprehensive and wonderful answer. And as I listened to you, it made me remember and think of something that we often forget to do, is how are we moving each day when you talk about repetitive stress injury. If we're sitting down all day, depending on what our job is or what our job is over the years, you may have been chipping away in some way at your spine. And I know sometimes for me, depending on how tired I am when I go to sleep, or I, take a sleeping position that I know in the morning, I'm not going to wake up and be able to move as well. So depending on how I have my pillows tucked at night and how tired I was when I go to sleep, if I'm sleeping on my hand or have my shoulder in some poor position. And I think, in your introduction, when we mentioned you get in that hiking and that soccer, so having some movement in the day, I think, keeps the body primed for wellness. And I know that certainly when people are suffering from depression or anxiety or some malady, what they end up doing is maybe sitting still, which is not the best thing for promoting health and wellness in certain cases.
Yes, absolutely. Particularly for people that spend a lot of time in front of computer screens, which I have a tendency to do myself these days, it's important to get up and walk around on a regular basis, at least once an hour, and preferably more often.
Yes. Dave, this has been a fantastic conversation, and Bob and I want to thank you so much for being on our show today.
It's been a pleasure. Thank you.
Dave, would you tell our audience how they can get in touch with you if they want to find out more about your work and your research?
You bet. The website is stressillness.com, stress illness being all one word, and they can also email me at drdave@stressillness.com. I'm not seeing individual patients these days, but I can certainly provide answers to questions via email.
All right, fantastic. Thank you so much. So, audience, you can get in touch with Dave at Dr. Dave at stressillness.com, and his website is the same, all one word, stresssillness.com, and you can just shoot him an email and ask him your questions and learn more about PPD and how to keep yourself well. Thank you so much, Dave.
Thank you.
Dave, what final thoughts or key idea would you like our audience to take away from today's broadcast?
You know, I think the most important concept is that physical symptoms that don't have a diagnostic explanation are very likely linked to one or more forms of stress in a person's life. And if people look into that, there's a good chance that they're going to come up with some answers that will lead to relief.
Wonderful. So, Dave, I want to thank you for being our featured guest today and being on our show. Audience, I want to thank you for listening, and I want to thank Dr. David Clarke for being our featured guest. And wherever you are listening to our broadcast and whatever time zone you're in right now, thank you so much. We appreciate your presence and trust that you'll benefit in some major or minor way from the information we delivered during today's show. We welcome and look forward to receiving your comments about our show. Please let us know if there are any additional topics you'd like to see us cover, or a guest whom you enjoyed you'd like to have us invite back. Please contact us through our website with your feedback and suggestions. Remember, listeners, if you'd like to experience the same benefits our coaching clients get with us, including learning how you can get more results in your day and easy ways to dissolve your chronic pain, stress, and anxiety, then give us a call at 954-900-2179. Mention that you heard our Stress Free Now podcast show, and you'll receive a free gift from us. Call or email us today to schedule your appointment. For Christine Wright, this is Dr. Robert Wright, Jr. of www.stressfreenow.info. Until next time, be safe and be well.